Dear friends, good evening. Now I am going to explain you the present scenario in Tamil Nadu and other places in India as a whole, the real present scenario that is prevailing here. You should understand what is what. So many people I know who are waiting for the NEET examination results. I know very well how many of you are going to pass through that, I do not know. But you got only 6,000 seats in Tamil Nadu, likewise certain things everywhere. 9,000 seats in Tamil Nadu. But how many people have already applied for? Not only this year, last year leftovers, they would have applied. 2 years back, they didn't get through the NEET. They also would have appeared for this one. So the problem is, if you don't get, you will be missing one full year, your academic year. If you compulsorily miss 2 times, you take it from me, I give it in writing, you will forget what all you learnt. Nobody can, with that same series, they can go and go for an attempt for 2-3 times. No, that is medically that is not possible. That is impossible, I can say. Okay, even if you get, what will happen? To complete MBBS, you have to work for minimum of 5.5 years if you complete it in one shot. After 5.5 years, then again, includes house science I am talking about. Then if at all you want to do for a PG, what do you have to do? You have to wait for another 6 months because only in June you get that one. Your study ends in December. Okay, you have to wait for another thing. So another 6 years gone. Throughout India, you got only 6,000 seats, inclusive of all PGs I am talking about, 6,000 PG seats. But do you know how many people are appearing for that one who are completed MBBS? 1.25 lakh, you take it from me. This number of doctors are appearing for 6,000 seats. Again, if you do not get a seat for 2-3 years, you are no more a doctor. I tell you. Why? A doctor, not only he should read, sir, continuously I will be telling you, unless he touches the patient, he will forget the subject. Don't think it is something, reading something, getting mugging, and spilling it over the paper, get through, get some mark, get become doctor. No. Application, very important. Clinical finding, very important. A doctor should be always touching the patients. Then only they will be again and again brushed up of what they have learnt. For 2 years, if they are out of this contact, if they be sitting in the library or any place, completely preparing themselves, they are no more a doctor. So what bothers me is, you take it from me if you get it. Even after only 9 years of your youth, you are going to become MD or MS. What are we that? Nowadays, I tell you one small incident. Before 10 years, as a senior practitioner, I used to get minimum of 2 to 3 invitations stating that, Doctor, we have completed our MBBS. Now I am opening up a clinic somewhere here. You kindly come and bless. Likewise, I will be receiving invitations from doctors who have completed and who are opening up, setting up new practice, new clinic somewhere in and around my area. But believe me, since 10 years, I haven't received not even one invitation. Or when I'm going to my house and coming back and moving around, no way I have seen one new setup of a hospital, a doctor is placed, a new doctor. No, absolutely no. Since 10 years, the doctors who have completed MBBS, what they are doing, you think, can tell me? What they are doing, neither they do practice, nor they don't get any PG seat. What they are doing? Absolutely, they are literally, I can say, wasting. I should not say like that, but it is a fact. They are getting a job in any hospital as an internee for 30,000 rupees, 50,000 rupees. Very, very, very heartbreaking. Very much. I feel very sad. Is this the way a doctor should be? Absolutely no. Your parents, how much money they would have impelled on you. How many parents there on the affluent side, you think of them? The middle class, upper middle class, they would have strived a lot to make you a doctor. In spite of that, when you do not have any return, what are those people they will think? How do they feel? You think students, doctors who have completed. Everywhere, I'm telling you, this is an open scenario available in the present situation. So here what I'm telling you, only 13 lakhs, that alone, along with the collateral. Nothing more you need to become a doctor in US for American board certified, recognized MD degree. What does you want? Straight away in 5 years you become MD. For that you have to wait for 9 years. You have to shell out minimum of, I tell you, 4 to 5 crore. But for that you will not get the MD at all. Yeah, for any capitation, no, only 2 crore, 3 crore. Per year you have to give 30 lakhs. Then for 3 years it comes to 1 crore. So I think this is for MD. It's the open secret I am talking about. Is it possible for you? Is it necessary for you? This is what repeatedly I am asking you. Is it necessary? Is that necessary for you to work on like that? You come, be with us for 5 years. At the cost of 13 lakhs alone and with the collateral. Finish, your job is simple. We see to that you get into America. You pass through Assembly Part 1. This is an assurance I give you in the open video. We see to that you come out. Because we are going to conduct weekly exams. We are very strict. Now you may think I am very casual, lenient, humble. No, everything is there. But regarding the management of classes, no. The patients, the students will face a strict conditions they will be in there. So this is repeated, I tell you. This is a golden opportunity. Don't miss it. Don't be going this way, that way. No, you have to write the examination. What examination? After NEET, you are going to be there in MBBS, then you have to go for MD, for which you have to pay more. Would you mind? Would you come to say that you'll be in one shot, you'll be getting everything? No, absolutely not possible. Let us be practical. I'm not exaggerating. I'm not putting you down. I'm telling you the fact. So kindly come for this Aruba Island and our Bay University and be qualified within 13 plus lakhs and again have collateral. This is one thing I want. And with this, I can make you a great doctor holding an MD degree recognized by American board certification and be a citizen of America with green card and have your life there. And the whole generation will be a little different and the total setup will be different. This is what repeatedly I am telling you. And I am suggesting the parents to consider what I told you. Whatever I said, I am not pulling you to my Bay University, not at all. It is not my idea at all. I am telling you the fact. You go and verify. You yourself will accept. Okay. Thank you so much. I wish you all the very best. Thank you so much. God bless.